If you've delivered a baby by cesarean section, you've had a major abdominal surgery, and it's important to rehab from that abdominal surgery. I'm going to talk about today scar mobilization. So it's important to mobilize your scar from your incision for a number of reasons. We want to decrease pain around the scar and any pain in the pelvis and low back that can be attributed to the adhesions that form around the scar. Adhesions from the scar can also contribute to incontinence, even painful sex. So we want to make sure to prevent that. We want to also increase the chances that you can have a VBAC later on, if that's your sort of thing. We want to improve the appearance of the scar and even the belly. We're going to do this by mobilizing the scar, and this will increase the nerve and muscle connections around the lower abdomen and get the skin moving and set up for a successful rehab. Let's look at the anatomy of a cesarean section. We have our beautiful pregnant mama sliced in half. The cesarean incision is made right here. So appreciate how many layers, it's all about the layers that the incision goes through. Skin, subcutaneous fat. We have fascia and muscle down to the peritoneum, which protects the organs, into the uterus, amniotic sac, and to the baby. Appreciate that there are 7 different layers that are cut through during the surgery. It's all about the layers when we're talking about scar mobilization. So these different felt pieces represent different layers that are cut through. Let's go through them all. First on top is skin and subcutaneous fat. Then underneath you have fascia and abdominal muscles running together. Next deeper is the peritoneum, which houses the organs, protects the organs. Here's the bladder that is moved out of the way. And then you have your uterus incised through. The amniotic sac is gently punctured. And hi, there's the baby's head. So when you're being sutured back up, baby and amniotic sac are accounted for. Your uterus is sutured back up. The peritoneum heals nicely on its own. Then another layer of sutures is the abdominal muscles with the fascia. Lastly, subcutaneous fat and skin are likely stapled, and there's your C-section. After a surgery, our body has an amazing ability to heal itself. After a doctor sews up the varying layers of tissue, collagen is laid down. Collagen is a tough substance, and that's good because it binds the layers together. However, too much of a good thing is where we run into problems, and that's where scar tissue forms. That's why we want to keep the scar moving to prevent scar tissue. If it's been a number of months or even years after your cesarean section, no worries. Scar tissue mobilization is still beneficial to help your scar move and promote scar remodeling. Moving the scar around will help the tissue lay down new collagen in a good and healthy manner rather than promoting scar tissue. We took a look at the cross-sectional anatomy and then examined the 7 different layers that are sutured and which layers are sutured together and how adhesions might form from scar tissue between each layer. Scar mobilization increases the slide and glide between each layer that is so important for every movement we make with our body. If we bend over, we want the muscle to slide over the underlying uterus. We don't want any scar tissue and adhesion down there. If we turn and reach for something, we want the skin to move over the top of the muscle. Let's examine how we can mobilize our incision scar. Once you're ready to perform the scar mobilization, go ahead and find a comfortable spot to lie down in. Lie down, knees bent up, and a pillow supporting your head and shoulders. About 4 days after your incision is a good time to start scar desensitization. So just gently running your fingers right over parallel to the skin, not directly on top of the incision, but around the incision. This is to desensitize the nerves, get you used to touching the incision. Some emotions might come up. We want to be mindful and respectful of that, and this is part of the process, letting go of any of emotions during those first few days postpartum. Very gentle. After a couple weeks of desensitizing the scar, you can start to mobilize the deeper layers. Remember our anatomy? It's all about the layers. We're going to angle our hands downward more. So now we're not parallel with the skin. We're angling our hands down. I'm pushing downward. Then I can go upward above the incision. Just pulling and feeling for any spots of tension and adhesion all across. And the other side, pulling upward. Maybe holding on a spot that feels particularly adhered and doing some circles, searching for more areas of tension, upward, downward. Now I'm going pretty fast. Go ahead and make some time to relax into this and really key into what you're feeling and assessing in your body. Normal tissue healing time is 4 to 6 weeks. So at that point, really angling our hands downward, about perpendicular with the skin. We're moving all the way over to the edge of the pelvic bone at this time, going around the incision, making circles, moving upward, moving downward, feeling what direction is most restricted. At a couple of months postpartum, you can start to distract the skin and underlying tissue pulling up. If you find any particular adhesions with distracting upwards or resisting downwards, hold on that resistance and move your hip. Heel slide in and out alternately. March the knee up and down, holding on the restriction. Keep moving. Another example would be holding on the restriction and a distraction and rotating your knees. Find which movement and restriction area works to best mobilize your individual scar. In summary, we want to start off our scar tissue mobilization very gently if you're newly postpartum with a C-section. Start by using your hand parallel to your incision and to your skin to desensitize and get the top layers moving. As time goes on, maybe the 4 to 6 week mark, angle your hand a little bit more down to reach the deeper layers. After a number of months, it's okay to put your hand perpendicular to your skin to get the deeper layers moving. For an advanced mobilization, go ahead and hold on any restrictions or adhesions you find and move your leg or spine. Hopefully you learned a lot from this video. You learned how to assess your body and to treat yourself. Feel free to share this video with your doctor and any friends who have had a C-section.